Hi, my name is Dr. Kyle Kinmon with Certified Foot and Ankle Specialist, here to talk to you about an update on total ankle replacement. Ankle replacement has come a long way over the last 9 years since I did my first implant. So back in my training time, back in the late 90s, early 2000s, ankle replacements did not have a very good reputation. The results were not very good, a lot of failures, and so they lost favor over time until around the 2005-06 timeframe. Wright Medical came out with the in-bone ankle replacement, which really, due to the better instrumentation, resulted in much better outcomes for patients. And so in 2009, I did my first in-bone implant, and we've been doing those ever since. And we have had some videos out. I believe it was on CBS at one time with the first in-bone implant in this area. So I wanted to give you an update. Since then, Wright Medical has continued to develop and engineer even better implants and better instrumentation to put these implants in correctly. And due to that, the results keep getting better and better. Patients are doing extremely well. Again, it has to be the right patient. The criteria to qualify for an ankle implant are very strict, and we adhere to that to avoid failures. However, if you are a good candidate for an ankle replacement, the results today are very good. Recovery is less than that of an ankle fusion, and the results are great. Many people notice great reduction in the amount of pain, improvement in range of motion, improvement in functionality, able to return to activities they previously were unable to do. So it's extremely rewarding. Currently, we're using the Wright Medical Prophecy, which means CT guided Infinity implant, which is lower profile than the previous in-bone. And again, those results are great. The procedure time is reduced, recovery time is reduced. Patients are bearing weight in as short as four weeks in a boot, some closer to 6. But playing golf by 6 to 8 weeks is not uncommon with an ankle brace on in the right patient who does well. And so if you suffer from ankle arthritis, if you've been told that fusion is the only option and you want to avoid that, come see us at Certified Foot and Ankle, and we'll diagnose you properly and make sure that you're a good candidate. And if so, ankle replacement may be best for you. The results are very good lately.